Tessa. I'm the RN who's going to be doing your neurological examination today. We are going to be doing a non-invasive test so you won't feel any pain, and we'll be assessing the cranial nerves 1 through 12. Do you have any questions?
I don't think so.
All right, great. Let me go ahead and close this. Okay. So to start off, can you go ahead and start by stating your name and date of birth?
Anna Ketters, and 6'5", 97.
Okay, and do you know what today is?
Today is April 1st, 2020.
Yes, happy Fool's Day. So to begin with, we are going to start out with assessing cranial nerve number 1. And so to do this, I would ask you to close your eyes, and I'm going to stick a good smelling object underneath your nose, and I just want you to describe that smell for me. Okay, go ahead and take a smell.
Flowers?
Yes, peony scented candle. All right, to assess cranial nerve number 2, I am going to ask you to cover your right eye, and I'm going to ask you how many fingers I'm holding up. All right.
1, 2, 5, 4.
Good. All right, and go ahead and switch eyes.
1, 2, 3, 4.
Good job. All right, the next cranial nerve we'll be assessing is 3, 4, and 6. So I am going to ask you to follow my pen light. Keep your head nice and still. Don't move your head left or right, up or down. Just focus with your eyes, okay? Keep your head still. Good job. Good. All right, and now I'm going to shine this light in your eyes. It'll be bright, but it won't hurt you or freak you out or anything. Just keep looking straight at me, okay? Okay. Pupils are equal, round, and reactive and accommodating to light, so that's excellent news. Now we are going to be testing cranial nerve number 5. Going back to number 5, I'm going to ask you to go ahead and bite down on your teeth as if you're clenching your teeth. All right, good, and then go ahead and release. Perfect. And now we're going to test cranial nerve number 7. Go ahead and smile for me really wide. Good. Now close your mouth. Squint your eyes really tight. Close them really, really tight. Good. All right, go ahead and frown for me. Good. All right, and go ahead and puff out your cheeks. Perfect. All right, now we're going to be testing cranial nerve number 8. I want you to go ahead and cover one side of your ear, and I'm going to whisper 2 words in that ear, and you got to tell me what they are, okay?
Flower child?
Yes, and then other ear?
Green grass.
Yes, good job. All right, now for cranial nerve number 9, I'm going to shine the light in the back of your throat, and I want you to say, ah, and I'm going to see if your UV light moves. Ah, good, perfect. It's all normal there. All right, and for cranial nerve number 10, I'm going to ask you to swallow. Not yet. I'm going to put my hands right on the side of your neck and feel for you swallowing. Can you swallow? Good, good job. All right, and I need you to say 3 words for me, okay, just to test the quality of your voice. Horse.
Horse.
TikTok.
TikTok.
And mama.
Mama.
Perfect. All right, for cranial nerve number 11, I'm going to test your strength. So if you could go ahead and push against my hands. Good. Now pull. Good. Go ahead and move your head to the left, to the right, up, and down. Good. Now let me check your feet. Can you put one of your feet up? Go ahead and push. Good. Now give it a pull. Good. Other foot. Push.
Good.
And pull. Good. Alright, one last test we've got to do. That's for cranial nerve number 12. I'm going to ask you to stick out your tongue and move it from side to side. So if you could go ahead and do that. Excellent, good job. Alright, Anna, everything seems to be in order and normal. Congratulations on successfully passing your neurological exam.
Thank
And
you.
you have a great rest of your day.
Thank you.
Okay. While Anna passed with flying colors and her neurological exam was overall normal, I was always keeping my eye out for abnormal findings. Abnormal findings can show that there is damage or destruction to that cranial nerve. For example, with cranial nerve number 1, if she wasn't able to smell the candle or smelt some sort of different smell, that would demonstrate that there was a problem with cranial nerve number 1. As for cranial nerve number 2, I was testing her peripheral vision and seeing if she could see how many fingers I was holding up out of her direct line of vision. And that tests to see if there's a difference between the left and the right side. Her left vision could have been perfect, whereas her right peripheral vision, she could have failed. So that could also demonstrate if there's hemiplegia or paralysis on one side of the body or stroke in the brain. For 3, 4, and 6, I was seeing if her pupils were reactive to light. They could have not been reactive to light, which would have been a medical emergency if the pupil isn't reactive to light. Her eyes were able to follow the pen perfectly, so that was great. For cranial nerve number 5, that was testing her jaw muscle and temporal muscle. She passed. Cranial nerve number 7, that was testing face symmetrically, which also demonstrates hemiplegia, or if one side of the brain is acting up versus the other side of the brain. Same with the cranial nerve number 8 with hearing. She could have heard in one ear, not in the other. Cranial nerve number 9, saying ah, that tested to see if there's, speech is working. And same with cranial nerve number 10, testing the same thing, seeing if she could swallow with ease. Swallowing issues, that would be a huge problem and would change the plan of treatment, definitely. Cranial nerve number 11, where she looked up and down, and I tested her grips and strengths, again looking for that hemiplegia, any differences to differentiate where a stroke could possibly be going on in the brain. And last but not least, cranial nerve number 12, where she sticks out her tongue, again another sensory function. Seeing how she can move, if there's any abnormal twistings or movings of the tongue, constrictures, any sort of thing like that. And that's all. I hope you enjoyed my neurological exam video.